Hello friends, myself Abhinav and I am a third year MBBS student, and today we are going to study anatomical features about scapula. Okay. So scapula. If you observe, scapula is also called as shoulder blade of the body, and if you observe, so this is scapula that I have, and what is this anatomical position to hold? So how can you determine its side? First of all, if you should know that this is called as glenoid cavity and it should face laterally, forwards, laterally, like this, and then there it is the lateral border which is thick and medial border is thin, so it should face lateral side. And spine should face, this is the spine of scapula, and it should face posteriorly. So this is the perfect, and it is scapula of right side, and that's how you determine the side of scapula. Okay, side there, and it is the anatomical position that you should hold like this. Then what are features of scapula? So if you want to know these features of scapula, it contains three borders, three angles, and three processes and two surfaces. So 3, 3, 3 and 2. Two surface, three borders, three angles, and three three processes. Okay, and you have to name during your viva. So what are two borders? So the anteriorly convex shaped, this is the anterior surface, also called as costal surface. It is concave shape, and the posterior or dorsal surface, it contains the spinous process, and then so this is the costal surface, and this is the dorsal surface. Then three borders. So if you observe, this is the lateral border which is thick. So this is the lateral border which is thick. This side which is thin is the medial border, and this is the superior border which is small, and it ends with coracoid process. This is the coracoid process. So this is the superior border. Okay. Then there are three angles. So this angle which is broken here of my scapula, it's called a superior angle. It's a superior angle. This is the inferior angle, where latissimus dorsi in the posterior border ends inserted, and then this is the lateral angle. This is the lateral angle, because this glenoid cavity should face lateral, so this is lateral angle, and it ends with glenoid cavity. So this, and there are three processes. Three processes are this is the coracoid process. It is a crow-like projection. Coracoid process. This is the this is the acromion process. It contains a facet for articulation for the clavicle to joints to form acromioclavicular joint here, and one more process is there, that is called as spinous process, present on the dorsal surface. So this is the acromion process. This is the spinous process or spine of scapula. It divides the dorsal surface into two fossa. The superior fossa, which is smaller, is called as suprascapular fossa, and this inferior larger fossa is called as infraspinous fossa. Sorry, supraspinous. My mistake. Supraspinous, and this is the infraspinous fossa. Okay, and these are the features. Now there are a lot of tubercles here. So on the glenoid cavity, on its lower border, or you can say on the upper side of lateral surface, this is lateral surface, it contains infraglenoid tubercle, and on the upper side of the glenoid cavity, it contains supraglenoid tubercle. Now this notch is called as supraspinous notch here, if you can observe. Yes, and that's all of the features of the scapula. Now we have to tell about the attachments of a bone. So for scapula, on the concave surface, it contains supraspinous subscapular fossa. So on subscapular fossa, on medial two-third subscapular fossa, it contains subscapularis muscle. Subscapularis muscle. Okay, and on the medial one-third, it contains subscapularis muscle. On this, its origin. Then on the medial border, if you observe, on the medial border here, which is thin, it contains insertion of serratus anterior muscle. It contains 8 digitations which are totally inserted on this medial border. So these 8 digitations are inserted here, from this, like this. Okay, and okay, then it is a infraglenoid tubercle. Infraglenoid tubercle. It contains the long head of triceps, and supraglenoid tubercle, it contains long head of biceps. So you can confuse with that, and the examiner will ask this question especially, and I was asked the same question during the VIVA in my first year. And then it where is the short head of biceps then? Short head of biceps is present in the coracoid process here. So coracoid process, on the tip of coracoid process, there are 3 things. First, on its medial aspect, it contains the short head of biceps brachii, and on this lateral side, what it contains is the coracobrachialis muscle. Also, along with it, it contains coracoacromion ligament here. Then on its this side, it contains pectoralis minor insertion. Okay. So this is okay for this surface. Now if you observe on this dorsal surface, spinous process dividing into supraspinous fossa, it contains supraspinatus muscle here, and on this lower infraspinous fossa, it contains infraspinatus muscle, which is present on its medial two-third. Then along with it, on its on its lateral surface, thick lateral border, it contains 3 muscles. First is the teres major, but it is not simple. Teres major, 2 slips are present, which is divided by the circumflex scapular artery. So this is, and then teres minor is present on the lower 1/3 of the lateral border. Upper 2/3 of lateral border is by teres major, and lower 1/3 is by teres minor. And on the inferior angle, it contains latissimus dorsi muscle. Okay. sorry, I am mistaken. It contains teres major here and teres minor is with subscapular artery. Okay, teres minor. Okay, sorry for the inconvenience. And then this is the spine of scapula, and this is crest of spine. From the lower border of crest of spine and till the lateral border of acromion process, it contains deltoid muscle. Its origin is deltoid muscle origins. And on the upper border of crest of spine and the medial border of acromion process, it contains trapezius muscle. Traps, the back muscle. Then this is the spine of scapula. Here the insertion of rhomboid minor is present. Here from the origin of spine of scapula till the inferior angle, there is an insertion of rhomboid major, and levator scapulae arising from this upper side. So here is the insertion of levator scapulae. And I think that's all for scapula. Thank you.